Twila, we just discussed briefly in the last segment the fallacy, you just referred to it briefly, of universal testing. You said it's not reliable. Probably could say more about it. But in reality, even if testing could be reliable at the point that it would be, and it could physically be conducted on every person in America every day, which seems to be what is being talked about. The whole point there again, is it accurate? And if testing indicates that someone is positive, then it seems that, therefore, it would have to be traced, as they call it, or tracked. And that means a whole lot more, like databases and government bureaucrats being involved and so forth. In Washington State, as an example, last week, Twila, I saw a state government advertisement looking for, I think it was about 3,000 or so social workers who would go door to door to test people. And what I read gave indication that they would have the power to possibly even remove children, like child welfare, because that's really where they'd be coming from, remove them from the home if a positive case was found. Now, an article I'm looking at here, the state is saying, no, that's not true. They don't have the ability to remove them. But I know, like you do, that whenever you open the door with your children to a social worker, you are opening the door to a whole lot more than what you ever thought about. So I was disturbed by that. But here's the point in the question. What is the truth about testing and tracking? You've already said some. Lay it out again in simple terms so our listeners can understand this.
So several things about testing. So there have been people in the hospital who are clearly experiencing COVID-19. They've got a low oxygen saturation level, but they're sitting there merrily texting away with their oxygen on. It's very odd, very, very odd. Doctors haven't ever seen this kind of thing before. And yet they test negative. It takes them maybe days or a week before they test positive. I just heard a doctor talking about how they have done autopsies of COVID-19 patients who have COVID-19, the virus, in their lungs, but they don't have it in their throat. And so where that testing is taking place is in their throat. So, you can't say that this is, reliable. And because it all depends on where you test. And then the antibody test also has some problems with reliability. Some people say you have to be tested 3 times to really be sure whether it's true or not. And then even if you have antibodies, they may not be the neutralizing kind. And then even if you have antibodies, no matter what kind they are, according to the World Health Organization, which is not my favorite organization, but nevertheless, according to the World Health Organization, they say there's no evidence that you can't be reinfected. So, what is all of this testing about? I really think that the only time testing really needs to happen is when you're sick. If you're sick, get tested. And you might have to be tested several times to actually figure out that you have COVID-19, or it might always end up to be negative. But I don't see any other value in it, because the second they test you is the only time they're testing you. You could go out and meet with somebody who has COVID-19 2 hours later, and you could spend a lot of time with them and get infected. And by the time your test comes back saying that you don't have COVID-19, you actually have COVID-19. So, to me, it's just a whole bunch of talk about something that in the end seems quite meaningless.
Which leads me to this particular question that I have for you, Twila, and that is that if the testing doesn't seem to be altogether valid or reliable, and even if the truth about the antibody tests aren't accurate as well, what's the sense of doing any testing at all? Right.
I agree. Unless you think you've actually got it, or unless you're really sick, that's when you want to know. Because as I said before, the majority of people will have COVID-19 and they will never know. But this is an important thing when we're talking about contact tracing, which is really a very hot issue today. And there are expected to be 100,000 to some say 180,000 contact tracers roving around the country, talking to anybody who's been diagnosed with COVID-19 about everybody that they've been in contact with. So if you're never tested, you will never be diagnosed positive, which will take you sort of out of that net, except if somebody else is tested and they list you. Then if they list you, then you're going to have a knock at the door or a call on the phone or maybe a visit in the hospital by one of these contact tracers, which are really government reporters. They're government investigators, government reporters, whatever else their real job is. When they become a contact tracer, that's what they are. And you don't have to answer any questions. You don't have to give those names. You have to remember that if you give names, you have no control what then happens to those people whose names that you have given. And that could include them coming to the house and telling those people that even though there's maybe only a probability that you're sick, or there's only a possibility that they got infected, that these people would have to quarantine themselves for 14 days and, depriving them of work or, whatever, until they prove after 14 days later that they don't or aren't sick. And the contact tracing instructions that I've seen is that the contact tracer has to check in every day and make sure you've taken your temperature. Now, the temperature thing, so first of all, that's an everyday check by a government-employed person, a government reporter, who can then, if they don't think that you're doing what they think you should be doing, can then call somebody higher up from the local health department or the state health department, to bring the law to bear upon you. But also that whole thing about taking the temperature, there's all these businesses now that want to take your temperature because that's what the state's telling them to do. But again, the majority of people who get COVID-19 will be asymptomatic, which means they'll never have a fever. So then you take somebody's temperature. They may actually have COVID-19. They don't have a fever, and so you let them in, and you think you're all fine and dandy healthy. So again, it's just something that is being mandated that doesn't necessarily end up being very useful or meaningful at all, because it'll lead people to false assurances when indeed the person that they're interacting with that doesn't have a fever may have COVID-19 and may be spreading it around. But as one of you said, some virologists and epidemiologists would love to get close to that person so they'd finally get the illness and they never have to worry about it.